You're watching Lunchtime Agenda. Let's bring into the discussion Liberal MP Michael Sukkar and also the Shadow Assistant Health Minister, Stephen Jones. Thank you both for your time this afternoon. Stephen Jones, first to you, are we doing enough to battle Ebola and prevent it from coming to this country?
Well, two things. I make absolutely no criticism of the government in terms of our domestic response. I have full faith in how our quarantine authorities and our state-based medical experts are dealing with the risk, albeit a low risk here in Australia, of transmitted infection from overseas. But I do think that we can be doing more when it comes to assisting those West African nations. When you see the roll call of nations that are in there with experts on the ground, everyone from Cuba to China, you think, well, where's Australia? We're missing in action. We do have some of the finest medical professionals in the world. We know from the AMA and others that there are plenty who are keen to get over there and lend assistance. We think the government can be doing more and should be doing more to assist our medical professions to be in there and to be assisting to stem the spread of this disease. And we think we should be working more closely. We did just hear
from the Health Minister, though, earlier, Laura Jay's speaking to him, and he was pointing out that the 30-hour flight would put those workers in danger if they needed to be repatriated to Australia. He said the advice from experts that he's received is that it's probably not the best idea.
Look, this is an international response and a lot of our military and other allies are in there on the ground as well. Surely it's not beyond our wit and wisdom to be able to work with them to put in place some workarounds, some responses to those sort of situations. You know, we've got the Brits, the Americans in there on the ground, the Chinese and others in there on the ground. I'm confident with the best will in the world we'd be able to reach an arrangement with them to get around the issue that the Minister has identified. And I think the rest of the world, and I think the majority of Australians are looking to the federal government to show some leadership here. We are a generous nation, and I think people can see for humanitarian reasons as well as for some national self-interest that we should be in there doing what we can to assist this, to stem the spread of this terrible disease.
Michael Sukkar, a response to that, but also, I mean, clearly this is a massive issue in Africa, but are some in Australia guilty of overhyping it, the media included, perhaps?
Look, I think with these sort of matters, I defer to our medical officers and authorities, not to Bob Catter. I think we have very robust screening processes in place, and as the Health Minister said a little earlier, we shouldn't overhype the number of people that may be returning to Australia from West Africa. So on that score, I think, yes, there are some that may be guilty of trying to overblow it. But having said that, I understand why the public would have concerns, and I think that's why it's important for us, and I commend the Health Minister for reassuring Australians that we have world-class health authorities and screening processes in place to make sure that we are protecting Australians from the risks. Now, in relation to the point that Stephen was making in relation to help for the affected countries in West Africa, I would reiterate the comments of the Health Minister. We have provided $18 million of funding very quickly, very early on. We're talking many weeks ago, in addition to the $40 million that we provide through the World Health Organization. And as the UN said, that was the type of help they needed, and we made the judgment that that was where Australia could make the best contribution. It's not good enough from opposition to glibly say, well, risking Australian health workers' lives because we can't get them out in time, a 30-hour flight is what's being quoted. To say that, oh, well, we just should wish that away by sending Australian medical teams, I think would be very irresponsible. So we will take advice from our medical authorities. The UN have said that the money we have provided is the best thing that we can do to help right now, and importantly for Australian medical officers, we need to ensure that their health is a priority as well.
David, can I make this point? Okay, we've already got medical professionals on the ground there. We just don't have it being done in a way that's coordinated by the Australian government, so the risk exists. I'm not being glib at all. I'm saying that if we want to do the best thing that we can, we should be having a nationally coordinated response, including how we deal with evacuation if indeed we have to face that risk.
Well, I think the
Okay, well,
response
look,
has
I want to
been
move on to
very well
the COAG talks in Canberra today, more broadly on the funding of health and education for that matter. This is what a couple of the premiers had to say on the way in.
Obviously, that's something that's going to be raised. Curiously, it's not on the agenda, and the reason it's not on the agenda is because it's an embarrassment for the Commonwealth to have torn up signed agreements that have been reached with each of the states and territories.
Health is the biggest cost to every state and territory. It is rising at the quickest rate, and obviously state finances aren't in a capacity to deal with them alone. So we need to do it together.
We signed up to the Gonski deal, and we recognise that the Abbott coalition government is committed to the first 4 years of that deal. We believe and we know we signed a 6-year agreement with the federal government of the day.
So even the Liberal premiers there saying that health and education funding into the future is not sustainable. Michael Sukkar, Tony Abbott says that the coalition is not in the business of raising taxes. How then can health and education be funded properly, be it at a state or federal level in the future?
Well, look, I'd make the first point I'd make is that health and education funding increases every year over the forward estimates, notwithstanding the scare campaign that's been run by the opposition.
But the premiers say not enough.
And look, I'd say that COAG meetings for time immemorial have had state premiers and treasurers rightly arguing for more money for their state, and I think that's wholly appropriate for every state, irrespective of their political persuasion, to do that. What we have to do as a federal government, funding 45% of state budgets, is make sure that we can balance the books. And as everybody knows, we've inherited a debt and deficit disaster from the Labor Party. And I think that the Commonwealth and state governments do need to come together to ensure that we have fiscal responsibility at a Commonwealth and at a state level. And by doing that, the dividend ultimately is more money for health and education, because ultimately the less money we spend on interest servicing Labor's debt is more money that we can plough into health and education and all other essential services.
Stephen Jones, if Labor believes so strongly in funding health and education properly, why not nominate a way to do it?
Well, let's be clear. After $80 billion has been cut out of health and hospital and education funding in the last budget, it's extraordinary that it hasn't been placed on the agenda by the Prime Minister. Indeed, he's trying to keep it off the agenda. We're more than happy to have a constructive.
So why won't you nominate then a way to replace those funds?
We had a proposition, and you know, the thing
more debt,
that,
more borrowing.
No, absolutely not. I mean, if you look at the debt, over half the budget deficit has been created on the government's own watch. They didn't have to give a near $10 billion handout to the Reserve Bank. They didn't have to cut revenue streams such as the generous superannuation
but
taxation
this year's deficit is not the issue. We're talking about the deficits blowing out into the future, Stephen Jones. This year's deficit is not really the issue that the premiers are talking about. They're talking about the lack of funding into the future. As the population ages, there are less people in work to support that ageing population, health deteriorates, costs go up.
Yeah, well, the first thing you don't do is start tearing up agreements that have been reached in good faith, David, in respect of both the health and education agreements that have been reached. You don't start tearing them up and telling the states that they're on their own. And that's the point here. You've got health ministers pulling their hair out, not knowing how they're going to meet their budgets right around the country, irrespective of their political persuasion. Education ministers who put in place spending arrangements in good faith. The Commonwealth has torn all of that up, and they're putting nothing in place in response. Now, it's another 2 years before the next federal election. You ask, what is Labor's plan? Well, we'll have it in place well and truly before the next election. But the point here for today is what is the government's plan, and clearly they do not have one. Their budget is in
Michael
disarray.
Sukkar, we've just got 30 seconds left for a quick response to that.
Thanks, David. I'd say the agenda that COAG has today is very full, very important. Looking at how we can roll out our $50 billion infrastructure program, the ongoing work, the standing agenda item of COAG in relation to deregulation, because at the heart of so many of our fiscal problems and fiscal questions will be how do we grow our economy more quickly, how do we grow jobs, because ultimately by doing that we increase tax revenues, which then mean hopefully we can start paying back Labor's debt and then returning even more of that into the future as a dividend for the hard work of economic growth. So that's really,
gentlemen,
I
we
think,
are
a very ambitious
right out
agenda.
of time. Thank you both very much for your time, and thanks for your company at home. I'm David Lipson. The news is coming up next.